Hello, everyone. It's a great pleasure to stay again on the scene for a second time, for second performance on the second day of a wonderful, I believe, symposium so far. And my today's lecture named. So today's topic is concepts of facial aesthetics and application of stem cell peptides and exosomes for skin rejuvenation. Please pay attention to official disclaimer. And I'd like to start my lecture with the quote of English poet John Keats. Once he told, "The thing of beauty is a joy forever. Its loveliness increases, it will never pass into nothingness." And another quote belongs to him, that beauty is truth. Truth, beauty. Well, some say that beauty is skin deep, but from my own perspective, from my that's the way how I see things. I think that beauty, the real beauty, is something like that is hiding inside, right? The internal beauties. That's something we always think, just because we always think about that like facial beauty or attractiveness of the body, but it is pretty much something important, isn't it? Whether the majority of you will say yes or not to the statement, but nevertheless we all can agree on the statement that beauty is a power. So is beauty a power? I think, of course, it is. What it does? Let's look at a few statements. So, of course, it motivates sexual behavior. It activates reward centers in the brain. It motivates development of same-sex alliances as well. And that is something that we can also observe in sales. Something that's beautiful. What is beautiful is great. I'm going to buy that. Let's say a few words about beauty premium phenomenon. So individuals are more likely to give personal information to physically attractive people than less physically attractive people. Next, physically attractive people are more sociable and less socially anxious and lonely than less physically attractive people. Another wonderful, fascinating thing, that a physically attractive person is more likely to be found less guilty than a less attractive person, while they are charged with the same crime. It's kind of funny how the world works, but it's something that was found found to be true. Then we go further. So in the wonder of milestones, in one of the late marks of the beauty science, Dr. Langlois and others, they compared so-called unattractive adults and children to the attractive ones, and they found out that the attractive adults and children were treated more positively, were judged more positively, they exhibited more positive social behaviors, and there was a high degree of agreement on facial attractiveness between different genders, between different ages, between different cultural groups, and that was not based, it is quite important, on almost arbitrary cultural standards. So it's been always a notion, like 15 or 20 years ago, that somehow the beauty and attractiveness is linked, is related to cultural standards. But also because of the ongoing research, it's been disproven that beauty is somehow related, it's no longer related to these cultural standards, and it is more has of evolutionary basis, evolutionary background. Even kids, like the small kids, very, very tiny ones, they are preferably looking into the attractive faces. So it's something that is like really is inside of us, like it's really has evolutionary basis. And so even though, like, you know, the man left the cave like 20,000 years ago, 20,000 or many more thousand years ago, we are still looking at the same features of the face, and we are judging the person on the special features. And what really matters the most currently, and so this is the current notion, current theory, and current convention, are a few things. So why do we like attractive faces? What matters the most? Certain things, like first, it's averageness. Second, what matters is symmetry. And 3, it's a sexual dimorphism. I'm going to show you some results of the trials, and basically there is a lot to discard just looking into the snapshot. So it's basically just the face and how we observe the face only. And of course, when we are also thinking about attractiveness, we shouldn't forget about certain things like charisma, like nice grooming and so on and so forth. So this is definitely certain things that attract people as well. So symmetry. So babies, as I said, preferentially gaze at symmetric faces. Symmetry may signal health, reflect environmental stressors, pathogens or parasites. Also interesting fact that symmetrical people of both sexes are reported to have greater emotional and psychological health, and symmetrical men were also found to have greater physiological health than their asymmetrical counterparts. So basically what we see from this snapshot, from the face only, so we are looking into this reproductional potential of the human species that we see somewhere around, and that is how we sort of receive the information about it. That's what matters for our brains, that's how we are looking for a partner, and that's why it matters. Then next, perfectly symmetric faces seems to be not so attractive like the original, slightly asymmetric faces. And saying about the averageness, so evolutionary pressures operate against the extremes inside the population. Thus, people with average physical properties have the best chance for survival. And that's why average traits may be functionally optimal for the, like average nose for optimal breathing. And we sort of pick up the average traits in some person, we think it might be better for reproductivity and so on. And that's why it attracts us. An average face has mathematically average trait values for a population. So computer-generated for prototypical faces, which are called composites, are known to be rated higher attractive than the single faces, which we use for generating them. And it's interesting, it was also found to be true even for dogs and wristwatches, and I believe some other models that are just generated to receive certain averageness among some extremes among them. So what the caveat here? But average faces are attractive, but it doesn't mean that all attractive faces are average or the average faces are optimally attractive. Talking about sexual dimorphism, we have to say that there is a prevalence, obviously, of and different distribution of hormone, whether it's a male or female population. So, and obviously for female population, it will be like more prevalence of estrogen, and then women will have smaller than average chin, smaller than average nose, higher than average forehead, and there are certain features of the face that are more that emphasizes the attractiveness of the male face, like cheekbones, the growth of a jaw, and facial hair, brow ridges. Sexual dimorphism females. Feminine faces were found and are found more attractive than masculine female faces. Smaller than average chin, smaller than average nose, higher than average forehead are also associated with female attractiveness. It's quite interesting how luminance and lip color works, as well as the, the luminance of particular size of the face. So lip and periorbital regions contrast the lighter portions of the face. And emphasis on this effect promotes sexual dimorphism. Increased lip redness associated with female attractiveness and inversely related to male attractiveness. I don't see that often. Men with the lipstick, nevertheless, that's how it works. Sexual dimorphism in males also. Masculinity is attractive in male faces, but effect is smaller than seen in female faces with feminine exaggerations. Quite interesting fascinating fact that women in the fertile phase of the menstrual cycle find more masculine and darker complexions more attractive. And while women tend to prefer masculine male faces around ovulation, they have a preference for feminized male faces at the other days of the cycle. And here I'd like to mention that obviously the skin is the most universally recognizable and desirable things that attracts all of us. So and it's also related to either prevalence or presence or decreased presence of certain hormones, like for example in male population, like male would prefer the and will be attracted by the flawless skin with no hair, which shows the signs of low estrogen with no lesions. And for example, in female population, yeah, that will be more attraction to the facial hair, which will show the signs of like high androgens. Nevertheless, and the beauty and the entire attractiveness among all the cultures with no cultural standards is anywhere complicated and nevertheless universally recognized with an balanced proportion, symmetry, harmony. We as professionals who work in the regenerative, anti-aging medicine and of course aesthetics, we are pretty much know certain things, how we can, you know, how we can deal, how we can examine and evaluate the skin's face proportions in order for us to proceed with and choose certain treatments. So we can look into Glogau classification of wrinkles. This and that, different kind of Fitzpatrick skin categories might be useful for us to choose, for example, certain kind of peelings, or for example, laser treatments. And when having some expertise, usually we don't even look into these categories, we just know that. And what are we treating? We definitely treat some, most likely there is always demand from people who are getting older. Why? On the big scale, we don't really think about the hallmarks of biological aging every day, and I think most of the speakers have already mentioned this. However, talking about the skin aging, it's obviously two main factors. Well, it's pretty much like related to aging overall, but if we talk about if we discussing only the skin aging, so it's obviously a biological clock. It's and then there is a photo aging that is superimposed on different kind of all the direct protein damage and so on and so forth. So, and because of that, the ECM composition of the skin will be changing. So, even though the collagen, which is structural component, and the breakdown of the collagen fibers in the skin will take anywhere from 1 year up to 15 years sometimes. But this process is ongoing because of aging, because of photo aging. So we also observe such events like elastosis. There is involvement of matrix metalloproteinases, and all these processes will lead to fragmentation, cross-linking, and from histological level we move to some, you know, visible sources of information, how we can like look in the face and sort of understand like what we are going to do with this particular patient. So we observe the changes in fat pockets and ligaments, and obviously the skull is a subject for resorption. Whether it's there are certain similarities and differences between how the female and male skull ages. So there is a drop in nose, the jaw becomes bigger, but nevertheless we are facing with something with aging. This is the main thing. And just because of that, when we think what kind of treatment we can choose for certain patient, for a particular patient, we can think about either choosing some topical retinoids, cosmeceuticals. Pretty often in my practice I work and used to work with different kind of peptides and growth factors. If we have if there is a need and there are indications for dermal fillers, we will use them, and it's wonderful just because they stretch the extracellular matrix. Also there is a lot of water retention due to injection of hyaluronic acid, and it's a wonderful thing. We can also use lasers and plenty of other novel devices in our practice. However, in my colleagues and I, and talking about certain involvement of of the treatment of the skin, which I believe which is pretty much natural, just because with the treatment of the skin with the peptides, we can pretty much improve the complexion of the face radiance and so on and so forth. And one of the first peptides that was ever used for the treatment of the skin aging was placental peptides. I mentioned it yesterday. It was first ever used in the treatment of ophthalmological diseases in city of Odessa in Ukraine in 1910. But throughout the history, since the medicine was developing, there was a lot of trials and discoveries ongoing. While so-called traditional ultrafiltrates were used, for example, as you may appreciate on these pictures. So Dr. Franz Schmidt in the 40s in Germany, so he came up with the idea that he can treat different kind of burns with the long time lasting applications of different kind of peptides that he was mixing. For example, like in this case, he was treating this particular burn with the application of mixture of fetal skin, fetal connective tissue, placental and adrenal gland extracts, and he was topically applied for a long time, and as you see, there was much of improvements. And it was also used for treatment of scars and pretty much using today. So what we use nowadays in practice, and pretty much of course it's not something new, but we are using outside, we can use some lyophilized peptides, we can use mitochondrial peptides, we can use nanopeptides, and which is as for the nanopeptides, it's great just because they have high biological activity, biofunctionability, pretty high biodegradability, and injectability as well. So a lot of peptides that are involved in the work on aesthetic practitioner nowadays can be the peptides of mesenchyme, placenta, and skin. Mesenchyme is it has great potent regeneration of connective tissue. It can restruct the entire dermis layer. Placenta is has great regenerative capacities. It's awesome for the treatment of different kind of as I mentioned, if we want to replace some lost or damaged tissue, so placenta is a must. It's great for rehabilitation after peelings, laser resurfacing, and so on and so forth. And skin is can help with the renewal collagen elastin. Here I'd like to share with you certain results of the topical application of peptides for different patients. For example, here there was a 22-year-old female with a facial burn scar after an accident. She got quite an improvement. If you know how to use them with these scars, and especially if it's a young pinkish scar, not the old one, especially with the laser resurfacing, you can also achieve great results. I was quite surprised when we also found out that it is possible to treat, so even hypopigmentation can be treated with the peptides, which doesn't happen every other day. If there are certain combination of peptides with hyaluronic acid, and they can basically bring they can help to retain the water. As you may see, this lady, she got some forehead wrinkles and some wrinkles under the eye. So, and why? Once again, why peptide treatment appeals to me a lot? Just because these are natural occurring substances, and they work greatly. And as you may see, I always say that it's this is the after picture, right? And you may appreciate how the complexion improved, and what's the changes in the radiance. So this is natural visible results. And if you want to use any other kind of treatments, as I already mentioned, like dermal fillers, some Botox, for example, it's also possible if there is indication, but if there are indications for that. But which is pretty important from my perspective, it is the actual complexion of the skin, how it looks like. So it has to look young, has to have a young looking skin. So this gentleman has just a mild forehead wrinkles, and they disappeared only for after a few treatments. Whereas this gentleman got massive wrinkles on his forehead, another great result. this young lady got quite an improvement after just two sessions, and she got kind of like not related to menstrual cycle, some impairments on her skin, but it's also possible to do. For this gentleman, there was only one treatment done on his left hand, and you can appreciate what's the changes of the color and how it looks like only after one treatment on the left hand. So I'd like to say a few words about mitochondrial peptides, as they have gained a popularity within the last decade of years, and not just because they can, it's like ATP hub of our cell and produces like, and it does a lot of things. It regulates cell cycle, it can outdate apoptosis, if we can put it like this. It stimulates cell proliferation. It's also involved in the steroid hormone synthesis and so on and so forth. And during the lifetime, of course, we have mitochondrial dysfunction. It's pretty much like involved in the certain cellular consequences in aging skin cells, and like all those kind of changes like wrinkles, pigmentations, they're pretty much related also to mitochondrial dysfunctions. That is why we can, in practice of a static practitioner, we can use different kind of peptides and different kind of combination of peptides. So my fellow colleagues once did multicultural, multicentral trial where they were observed a group of subjects, and then the mesotherapy was done for them within the course of 26 volunteers, and they got third and fourth Fitzpatrick skin types, which is pretty much like look like Southeastern Asia skin type, like with a little tan. So there was most of the subject, they had two second and third Glogau class wrinkles, and the injections were done on within 2 months on a weekly basis. There was a photo done at the baseline end of the treatment and 3 months as post-treatment, and there was a outsourcing of the data from the different labs where the collagen, a few types of collagen were measured, and the nulicid and total elastin and tropoelastin. So none of the subjects subjectively, of course, said or had the impression of non-results. So to some extent they all have some results, and almost 80% of them, they got either moderate, excellent, and good results. There was a gradual improvement of wrinkle height and wrinkle depth during this trial. We got certain improvement in hydration and pigmentation, and there was changes in the collagen skin types and newly synthesized collagen, which was improved slightly. Not crazy spike, but still there was some improvement. What we are really happy about, there was also like the tropoelastin, which is the precursor of elastin, was the numbers were increased, which basically there was some improvement of elasticity of the tissue, basically the skin, and that was this is one of the most remarkable results. So for this particular lady, there was a lot of improvements for her pigmentations, hyperpigmentations. You can also change and modify your protocols and use, for example, exosomes in your protocols, which is like this is tiny vesicles that are moving in between of tissues that they can be and bring in their cargo. They like live in all the kind of liquids and all the kind of milieu in our body. They can bring bad or good cargo, but mostly we can in nowadays practice there is a lot of mesenchymal exosomes, and as I said, they create a great media for intracellular signaling and cell-cell communication, which can basically improve the cell metabolism, and skin repairs, regenerates itself. Exosomes are quite often used in cardiovascular, can be used for cardiovascular well-being, for neurological treatments, but we find it's also beneficial in aesthetic applications as well. And there are here a couple of results, and here is actually the after result. So after the topical application of exosomes, quite a wonderful one. taken from one of our American colleagues. And here is the result after like a lady who done one injection. I'm not mistaken, of exosome. Exosome. There was one or two sessions, like and she got like quite an improvement of the post acne, which also looks wonderful. So there are kind of different kind of protocols. You can adapt them and you know, go how it goes. Like most of the patients, they always like and they willing to have some natural looking faces without involvement of some heavy artillery procedures like whether Botox or fillers. But as I said, like if there are indications, you can use all of them. At the end of the lecture, I would like to tell that today the face is still it's still a visible source of either reproductive potential or beauty. And of course the beauty industry and the cosmetic industry is pretty much involved into it by the development of different kind of aesthetic products that can enhance such features of the face. And this but still, all the features of the face that are somehow improved, they're still the same that our ancestors were looking at. That is why I think that the skin is not only in skin deep, but it rather lies in the preferential, in the adaptive preferences of beholder. Thank you so much for your attention. And have a great day ahead.